I've seen nowhere in the world, and I've travelled extensively, I've seen nowhere that has done it systematically, everywhere, without senior leaders.
In order to get to the degree of service and reliability and safety and effectiveness and mortality and efficiency that you need, the top leadership all the way through the organization has to relentlessly focus on those patient-centered values. Person-centeredness is why we all went into healthcare, is to help people, their families, and their communities. And so the person-centeredness is moving from doing to or doing for to doing healthcare with another person.
So they put the user in the centre. All the decisions are about the people, not about the doctors and nurses in the car parking. They're about the individual.
If you want quality and safety and the best outcomes for the patients and families that you're taking care of, you can't do it with a bunch of quality officers and administrators and leaders in offices.
And it's a behaviour. It's not a theory. It actually needs done. You have to actually walk and actually go to where the work is.
Improving quality, driving out waste, variation, defect, it's hard work. It takes efforts of teams across boundaries, and it doesn't happen overnight.
There's no shortcut to inspiring the teams. There's no shortcut to monitoring the data. It just is day after day after day. And you have to stay on that same path, because if people start to see you move to the next thing or a new thing, people will think in 2 years' time this will go away and we can all relax.
Transparency is basically taking the results of your care, outcome, safety, service, hand hygiene, infections, complications, readmissions, whatever's important to you, and sharing it with the world.
The ability to shine a light on everything, on your data, on your work, to tell people what you've done.
We have signs throughout our hospitals that patients can see, that staff can see. It is a catalyst for change. So boundarilessness is the trust and interconnectedness of people, that the barriers of departments and inpatient, outpatient, and hospitals and clinics melt away.
So it's to try and stop silo thinking, because patients and families don't understand all these boundaries which we have artificially created.